Hello class, welcome to Chapter 2, Workforce Safety and Wellness. After this unit, students will be able to understand the importance of recognizing important hazards, coping with physical and mental stress, assisting patients and families with the emotional aspect of injuries, illness, and/or death, taking appropriate preventative actions to ensure personal safety, dealing with patients and coworkers with sensitivity, taking proper precautions when dealing with infectious diseases, and preventing on-the-job injuries. As emergency workers, to take care of others, we must take care of ourselves. This includes recognition of different hazards. One is personal neglect. If your safety is threatened, you will not be able to care for a patient. But it also includes just regular personal neglect, i.e. taking care of your own health, environmental and human-made threats, and mental and physical stress. The emotional well-being of an EMT and patient are intertwined, especially in a high-stress rescue. Wellness goes beyond the prevention of disease. It is a state of complete mental, physical, and social well-being. And as a healthcare provider, you should model a life of health and wellness. And a state of wellness must occur both at work and at home. At work, you should protect yourself and have a state of wellness through protection from communicable disease and scene hazards. And at home, through a healthy diet, exercise, getting enough sleep, refraining from use of tobacco, drugs, and excessive alcohol, and making sure that you take enough time to relax. As an EMT, you're often called to work in circumstances that are both acute and also can cause cumulative stress. And as an EMT, your role is to be prepared, anticipate needed resources, control the scene, and care for the patient. Your calm manner will calm the patient, family members, and bystanders. The more calm you are, the more calm the situation will be. When it comes to wellness and stress management, one thing to bear in mind is that prolonged physical stress can drain the body of its reserves. It can deplete key nutrients, leave you in a weakened state overall, and also more susceptible to illness. Stress is, in any event, thought, or action, perceived as a threat. Even people who are completely healthy may be constantly dealing with stress. And then understanding how stress affects you physiologically, physically, and psychologically can help you control your reactions and minimize the effects of stress. And regardless of how stressful the situation, you must focus on the following considerations in this order. First of all, personal safety, always first. And then scene safety, including safety of others. So first of all, your personal safety at the scene, and then the safety of your team as well at the scene. And then patient care, always in that order. Utilize the help of others, including your partner, police, a supervisor, other additional personnel, or even bystanders to help manage crisis situations. Stress management refers to the tactics that have been shown to alleviate or eliminate stress reactions in your body and in your mind. These steps may involve changing a few habits, changing your attitude, and also perseverance. Some strategies to help manage stress are to minimize or eliminate as many stressors as possible, change partners when you're at work to avoid a negative or hostile personality conflict, change work hours, change the work environment, Cut back on overtime. Continuing with strategies to manage stress. Change your attitude about the stressor that's particularly bothering you. Talk about your feelings with people that you trust. Seek professional counseling if needed and if available. Do not obsess over frustrating situations that you are unable to change, such as relapsing alcoholics and nursing home transfers, but focus on always delivering high-quality care instead. And try to adopt a relaxed and philosophical outlook. Some more strategies to help you manage stress are to expand your social support system beyond your coworkers. Develop friends and interests outside of emergency services. Minimize the physical response to stress by using various techniques, including periodic stretching or yoga, slow, deep breathing, regular physical exercise, which is 150 minutes a week, including cardiovascular effort, progressive muscle relaxation techniques, and meditation. And then also limiting your intake of caffeine, alcohol, and tobacco. Let's discuss wellness and stress management. The first thing we should talk about is nutrition. Your body's three sources of fuel, which are carbohydrates, fats, and proteins, are consumed in increased quantities during times of stress, particularly if a physical activity is involved. The quickest source of energy is glucose, taken from stored glycogen in the liver. Protein, drawn primarily from muscle, is a long-term source of fuel. Tissues can use fat for energy, and the body conserves water during stress. Other nutrients that are susceptible to depletion are the vitamins and minerals that are not stored by the body in substantial quantities. You should make sure that you have your body physically prepared for stress. Physical conditioning and proper nutrition are two variables over which you have absolute control. To perform efficiently, you must eat nutritious food. Food is the fuel that makes the body run. So limit your consumption of sugars, fats, sodium, and alcohol. Complex carbohydrates rank next to simple sugars in their ability to produce energy. Complex carbohydrates such as pasta, rice, and vegetables are among the most reliable sources for long-term energy production. Fats are also easily converted to energy, but eating too much fat can lead to obesity, cardiac disease, and other long-term health problems. Therefore, fats should be limited to 10% of total caloric intake, and that intake of fat should focus on monosaturated and polyunsaturated fats while avoiding saturated fats or trans fats. Carry an individual supply of high-energy food to help maintain energy levels, and maintain an adequate fluid intake. Now let's talk briefly about exercise and relaxation. Regular exercise will enhance the benefits of maintaining good nutrition and adequate hydration. When you are in good physical condition, you can handle stress much more easily. Regular exercise will increase your strength and endurance overall. And also plan physical activities ahead of time and use strategies that make your sessions more convenient, so you don't feel stressed while you're trying to get in physical condition to handle stress better. Then also, exercise will help you maintain sufficient strength to lift patient and heavy equipment. Now let's discuss sleep. Sleep should be regular and uninterrupted. Turn off your cell phones. Limit your caffeine and alcohol intake and tobacco use. And 8 straight hours of sleep may not be possible, but at least 3 sleep episodes of 2 to 3 hours each will provide similar effects, although it is much better to get uninterrupted sleep. Routine exercise will help promote the needed fatigue for restful sleep. Now we're going to talk about wellness and stress management in terms of disease prevention. Know your family's health history. The most common hereditary health factors are heart disease and cancer. Share this information with your personal physician. Lifestyle can be adjusted to help prevent disease, and specifically these kinds of diseases, if you are predispositioned to them. Also, you need to avoid tobacco and electronic cigarettes, or e-cigs as they're also known. Although there may be health benefits related to use of some alcohol, such as red wine, increased alcohol use may be adversely impacted on other body systems, including the cardiovascular, hepatic, immune, and of course the central nervous system, because it is a central nervous system depressant. Both prescription medications and illegal or illicit drugs may be used or misused. Both are potentially dangerous and can lead to health problems. So make sure if you are taking medication, that you're taking it as prescribed. Then you need to talk about balancing work, family, and health in terms of wellness and stress management. When possible, rotate your schedule to give yourself time off. Take vacations. And at any point, if you feel the stress of work is more than you can handle, seek help. Your employer will have resources available for you so that you can seek the help you need to decompress. Now we're going to talk about infectious and communicable diseases. An infectious disease is caused by organisms within the body. A communicable disease can be spread from person to person, or from one species to another, or also from a contact surface to a person or another species. Infection risk can be minimized by immunizations, protective techniques, and hand washing, and we'll talk a little more in detail about each of these. When these protective measures are used, the risk of the healthcare provider contracting a serious disease is negligible. Be sure to familiarize yourself with the following terminology related to infectious diseases. First is a pathogen, which is a microorganism that is capable of causing disease. Contamination is the presence of infectious organisms or foreign bodies on or within objects such as dressings, water, food, needles, wounds, or a patient's body. Exposure is a situation in which a person has had contact with blood, body fluids, tissues, or airborne particles in a manner that may allow disease transmission to occur. Personal protective equipment, or PPE, is protective equipment that an individual wears to prevent exposure to a pathogen or to a hazardous material. Routes of transmission, or the way an infectious disease is spread, include direct contact, such as becoming in contact with a blood-borne pathogen in blood or body fluids, indirect contact, such as a needle stick, airborne transmission, like sneezing, foodborne transmission, or the consumption of contaminated food, or vector-borne transmission, such as a bite from a flea. Risk reduction and prevention for infectious and communicable diseases includes the following, which we're going to review. But all EMTs are trained in handling bloodborne pathogens, and the CDC has developed a set of standard precautions, and we're going to review those now. The first is hand hygiene. Hand washing is absolutely the first line of defense and the most efficient and effective line of defense. And we'll go into detail later about how to do it most properly. So you have hand hygiene, personal protective equipment, which includes gloves, gown, mask, eye protection, and face shield. You have patient care environment, which includes handling soiled patient care equipment, environmental controls, textile and laundry, needles, and other sharp objects, and special circumstances where you have patient resuscitation, or you might come into contact with blood or body fluids, respiratory or hygiene, cough etiquette, which need to also be taken into consideration. Now, I said we would talk about proper hand hygiene. Hand washing is the simplest yet most effective way to control disease transmission. Wash hands before and after patient contact, even if you have worn gloves. If there is no running water, use a waterless hand washing substitute. However, let me footnote that by stating that you need to wash your hands as soon as possible, even if you have used a waterless solution, for two reasons. One, you might not have gotten complete sanitation of your hands, and the waterless solutions are antibacterial, but they are not antiviral. So hand washing, again, with hot water and soap is the most effective way of preventing disease transmission. Again, as I mentioned before, if there is no running water, use a waterless hand washing substitute, but make sure you wash your hands as soon as possible. Now, gloves are very key, obviously. Wear gloves if there's any possibility for exposure to blood or body fluids or any contact surface that might have any trace of these on them. You should wear vinyl, nitrile, and latex gloves. They are all effective protection. And wear heavy-duty gloves when cleaning things such as your ambulance. Always change gloves between patients. And removing gloves requires a special technique to avoid contaminating yourself with the material on the outside of the gloves. And we will cover this in Skill Drill 2-1. And we will cover it in class as well. Removing gloves, again, requires a special technique so that you avoid contaminating yourself with material on the outside of the gloves. Now, eye protection and face shields are very important. Eye protection protects from blood spatters. Prescription glasses are not as adequate. They don't cover as much of the eye area. And goggles and face shields are really the best, especially if you have heavy vomiting or blood spray, perhaps. Gowns provide protection from extensive blood spatter. They may not be practical in many situations and may even pose a risk for injury. However, if you can and need to, you should try to wear a gown. You should always make use of masks, respirators, and barrier devices. You should wear a standard surgical mask for fluid splatter and place a surgical mask on any patient with a communicable disease. Make sure that if a patient has tuberculosis, that you use a mask with a particulate air respirator on yourself so that you do not contract tuberculosis. There are many times when mouth-to-mouth resuscitation is important, so it may transmit disease, and the best way to prevent that is to use a pocket mask or a bag valve mask, and then dispose of these after use according to local guidelines. Now, proper disposal of sharps should include proper containers to help avoid exposure to HIV and hepatitis. Do not ever recap, break, or bend needles, and dispose of any sharp used items in an approved, closed, rigid container. And you will be trained on what those are, and I'm sure you will recognize the one in the picture already. Now, your employer has responsibility, and one thing to bear in mind is there is no guarantee of a 100% risk-free environment. However, by good environmental and work practice controls, you can reduce the risk greatly of exposure to a communicable disease from your job, because it is a hazard of your job. So make sure you know your department's infection control plan and follow it. Now let's talk about establishing an infection control routine. Infection control should be an important part of your daily routine, and the components of an infection control plan are as follows. The components of your infection control plan are determination of exposure risk, education and training, hepatitis B vaccination programs, personal protective equipment, cleaning and disinfection practices, tuberculin skin testing and fit testing, post-exposure management, compliance monitoring, and record keeping. Follow the steps in Skill Drill 2-2 in your text to manage potential exposure situations. Cleaning is an essential part of the prevention and control of communicable diseases, as it ensures the removal of surface organisms that may remain in the unit. Make sure to clean the ambulance after each run and on a daily basis. Use appropriate PPE while doing this cleaning. Remove contaminated linens and put them in appropriate bag for handling. And whenever possible, cleaning should be done at the hospital. There is more information about cleaning the ambulance in Chapter 37 in your text, Transport Operations. Now let's discuss immunity. Even if germs reach you, you're not necessarily at risk for infection. Immunity is a major factor in determining which hosts become ill from which germs. The host is the organism or individual that is attacked by the infecting agent. You may be immune or resistant to particular germs. And immunity means that you've been immunized or vaccinated, or you're able to recover from an infection from that specific germ that you've been immunized or vaccinated against. Preventative measures are very important. You must maintain your personal health. Annual health examinations should be required for all EMS personnel. And in terms of immunizations, you are required to get the hepatitis B vaccine or sign a waiver. Other recommended immunizations include tetanus, diphtheria, and pertussis boosters every 10 years, measles, mumps, and rubella vaccine, the influenza vaccine annually, varicella, which is chickenpox vaccine, or if you've had chickenpox, then you've developed immunity to it. However, you can develop shingles later in life and may need a vaccine for that. Now let's discuss general post-exposure management. If you are exposed to a patient's blood or bodily fluids, you need to make sure you turn over patient care to another EMS provider, clean the exposed area with soap and water, the exposed area on your body with hot water and soap. If your eyes were exposed, you need to rinse them for at least 20 minutes. Activate your department's infection control plan. You will have to complete an exposure report, and time is important. Some diseases will act very quickly, whereas others will remain dormant. But early activation of a plan is critical. Now, I had mentioned before how important scene safety is. The personal safety of all involved in an emergency situation is very important. Begin protecting yourself as soon as you are dispatched. Wear your seat belts and don appropriate PPE. Make sure to continue to protect yourself once you're on scene. Make sure the scene is well marked. Place appropriate warning devices to alert other motorists at the scene. Park a safe distance from the scene. Make sure there is plenty of light if it's very dark out. And then wear reflective clothing if it is dark. Now let's discuss some scene hazards. You may be involved in an incident that has hazardous materials that have been exposed or have become open to the environment. With hazardous materials or the suspicion of hazardous materials, you need to, upon arrival, look at the scene and try to read any labels, placards, and identification numbers from a distance, perhaps using binoculars. A specially trained and equipped hazardous materials team will be called to the scene to handle disposal of materials and removal of patients. The DOT, or Department of Transportation's Emergency Response Guidebook, that's pictured here in this slide, is an important resource to help in identifying hazards. Do not begin caring for patients until they have been moved away from the scene and are appropriately decontaminated, or the scene is safe for you to enter. But do not enter the scene unless it is safe to do so, or you've been told by properly trained personnel that it is safe to enter the scene and or treat a patient. Now, when you're dealing with electricity, dealing with the down power line is obviously beyond the scope of EMT training. So you need to make sure that you mark off a danger zone around down lines using utility poles as landmarks. The safety zone is one span of the power pole's distance. Energized lines can behave in very unpredictable ways. They'll really jump around. If you must enter the scene, wear protective equipment according to the type of incident. But let me just say this. Don't enter a scene with highly charged or down powered lines. Wait for the properly trained electrical personnel to arrive. Now, lightning is a different threat, and it's a threat in two ways, because it can be either a direct hit, or it can hit the ground and conduct current through the ground, through groundwater or metals that might be lying on the ground. A repeat lightning strike in the same area can occur, so the old adage of lightning can't strike in the same place twice is not accurate. It absolutely can. Avoid high ground to minimize the risk of a direct lightning strike, as lightning tends to strike the tallest object in a given area. And don't stand under a tree, which is usually the tallest thing in an area. To avoid being injured by ground current, make sure to stay away from drainage ditches, moist areas, small depressions, and wet ropes, and metal surfaces, anything that can conduct electricity. When lightning is nearby, make sure that you are the smallest target possible and drop all equipment. Now let's talk about a scene involving fire. Common hazards you're dealing with in a fire are smoke, oxygen deficiency, high ambient temperatures, toxic gases, building collapse, equipment and explosions. So make sure you are properly protected. Be trained in the use of appropriate airway protection. There are a large number of toxic gases that may be produced in a fire, including carbon monoxide, cyanide, and carbon dioxide. Carbon monoxide, cyanide, and carbon dioxide are colorless and odorless gases. Carbon monoxide is responsible for most fire deaths. Inhalation of cyanide prevents cells from using oxygen. There's always a possibility also that a burning structure will just collapse. Now, when dealing with vehicle crashes, these are one of the most common events for EMS providers, and they also provide some of the most unstable and potentially lethal situations that an EMS provider will face. Vehicle collision hazards include traffic, unstable vehicles that may fall on you, down power lines, risk of violence, airbags, glass, and sharp metal objects, not to mention the possibility of fire. Make sure you use sufficient protective gear to reduce the risk of injury. Now let's review protective clothing, which will help you prevent injury. Wearing protective clothing and other appropriate gear is critical to your personal safety. Become familiar with the protective equipment available to you. Inspect your clothing and gear regularly, ideally before you reach the scene. And there are different types. Cold weather clothing consists of 3 layers: a thin inner layer that pulls moisture away from the skin, a thermal middle layer that serves as insulation, and an outer layer that resists wind, rain, sleet, and snow. Then you also have turnout gear, which protects from heat, fire, sparks, and flashover. You've also heard it referred to, or may hear it referred to, as bunker gear. Now, gloves are extremely important. They protect from heat, cold, and cuts. Now, the one hindrance is that they may reduce dexterity in a rescue situation. However, they are critically important for saving the use of your hands. So, do not remove them unless you absolutely have to, but try to always keep your gloves on. You also have helmets, and helmets should be worn to protect the EMT from falling objects, especially when you're around a fire or a potential landslide situation. There are lots of situations where you must wear a helmet. The helmets should provide top and side impact protection. Secure chin straps are needed, and in electrical hazard situations, make sure to not only wear a chin strap, but also a face shield. And as far as boots are concerned, boots should be water resistant, fit well, and be flexible. Steel-toed boots are preferred. Traction is important for rescue situation, and 2 pairs of socks are better than 1 thick pair of socks. As far as eye protection is concerned, you should wear protective glasses with side shields during routine patient care. When tools are in use, make sure to use a face shield and goggles. For ear protection, use soft foam industrial type earplugs. For skin protection, you should protect against sunburn during outside work by using a sunscreen with a minimum rating of SPF 15. You may have to use body armor, which is bulletproof vests, and they can range from lightweight and flexible to heavy and bulky. But vests may not be practical for daily use. They are costly and do not protect against rifle ammunition or stabbing attacks. And as I mentioned before, ask yourself, is this a safe scene for me and my partner or crew to enter? If the answer to that is no, then don't enter it. Wait for properly trained personnel. You also have to use or consider long, loose hair, rings, and jewelry. Many EMS services have restricted policies regarding hair, rings, and jewelry, so make sure you know what they are. You should tie hair up neatly, limit the number of rings worn, and wear only a watch on the wrist. Now we're going to talk about caring for critically ill and injured patients. The patient needs to know who you are and what you're doing. Let them know you're attending to his or her immediate needs. Avoid making unprofessional comments during resuscitation, and treat all patients with dignity and respect. Now, responses of a critical patient include one or many of the following: anxiety, emotional upset. They may be sweaty and cool with rapid breathing, fast pulse, restlessness, tension, fear, and shakiness. They might also have pain and fear that is associated with illness or trauma, and the fear usually relates to oncoming pain and or outcome of the illness or trauma. So encourage patients to express their pains and fears. They may behave with anger and hostility, and these reactions may be expressed with demanding or complaining behavior. So make sure that you bear your personal safety in mind. Be tolerant because this is a person who's ill, and back out of the situation if the patient becomes hostile. Sometimes a patient is expressing severe depression, and this may be in response to illness, especially if it is prolonged, debilitating, or terminal, and can be physiologically, it can be physiologic depression and psychological depression. In other words, one's caused by a physical manifestation and the other is caused by a psychological manifestation. So be compassionate, supportive, and non-judgmental. You may be dealing with dependency, and a patient in that situation may become dependent on you due to their helplessness of their particular situation. So remain supportive and compassionate. They may be going through feelings of guilt. When patients are dying, long-term caregivers, family members, or even the patient themselves may experience feelings of guilt over what has happened. The guilty feelings may result in a delay seeking of medical care. You may also be dealing with mental health problems, which can include disorientation, confusion, and delusions, and this may be developing in a dying patient. And some common characteristics include loss of contact with reality, distortion of perception, regression into themselves, diminished control of impulses and desires, abnormal mental content. Or you can have someone who becomes very ill because of receiving unrelated bad news. They may be in the throes of the death of someone close to them or close to the patient, or they may, because of their behavior and depression, may cause the patient to give up hope. So your support is always very, very important. Some techniques when dealing with a critical patient. Make sure to avoid sad and grim comments. Remarks about a patient's condition may increase a patient's anxiety or compromise recovery. Orient the patient. In other words, say, hey, take a look at my face, or take a look at my eyes, or why don't you look at me? And, encourage conversation by eye contact and other methods. Use brief statements and help orient that patient towards their surroundings. And then be honest. Decide how much information your patient can understand and accept. Allow the patient to be part of the care given. If there is initial refusal for care, impress upon the patient the seriousness of his or her condition without causing undue alarm. If you say, everything will be okay, when it is obvious that it is not okay, you're not being truthful or fair to the patient themselves. But do allow for hope. If there is the slightest chance of hope remaining, transmit that message to the patient. However, it is not your role to tell a patient that he or she is going to die, and do let the patient know that you are doing everything possible. Make sure you locate and notify family members. Assure the patient that you will take care of notifying any of the appropriate people necessary that they ask for. And this may be a significant part of patient care because it will help calm the patient. Now, when dealing with injured and critically ill children, make sure that you care for a child as you would care for any adult. Consider variations in height, weight, and size when caring for your pediatric patients, and also their age, because that's going to affect the type of communication, like vocabulary, that you're going to use with them. And it is critical that a relative or responsible adult accompany the child to relieve anxiety and assist in care as appropriate. When dealing with the death of a child, the death of a child is a tragic and dreaded event. Be sure to do everything you can to help the family through the initial period after the death. Provide information about follow-up counseling and support services. Make sure you help the family in any way that you can. Acknowledge the death in a private place. Shock, denial, and disbelief are common emotions and reactions, especially to a child's death, but certainly to all death. If circumstances allow, let the parents hold the child, but use your best judgment to determine if this is appropriate. Let the family's actions be your guide. The family may want to see the child, and you should allow them to do so. They do have the legal right to do so. Prepare the parents for what they might see. Nonverbal communication may be valuable, such as holding a hand or grasping a shoulder, and silence may be much more comforting than any words that you could say. And when it comes to death and dying, death occurs either quite suddenly or after a prolonged or terminal illness. And the EMT will sometimes face death. There are different stages of grieving, and you as an EMT are going to grieve through a death, even if it's someone that you do not know, but it is something that it's important that you learn how to help manage. The grieving process includes denial, anger and hostility, bargaining, depression, and acceptance. And you're going to certainly be dealing with this with the family, most especially. So what can the EMT do? Ask the patient and family if there's anything you can do to help. Make sure you reinforce reality. In other words, don't let them deny that what they are actually facing isn't happening. So reinforce reality and be honest and sincere. Let the patient or family members grieve in their own way, and everyone grieves in a different way. There are those 5 general steps that we all go through, but some people have more tears than others, some people have more wailing than others, etc. When dealing with the patient and family members, make sure to use special care with dying patients and their families. And it is best, again, to be honest and do not give them false hope. Now, on this table, this shows some suggestions for responding to grief. So take a little bit of time and read it. Things not to say and things you could say instead. Now let's talk a little bit about stress management on the job. EMS is a high stress job. Obviously, some of the topics we've just gone over are heavy and difficult topics. However, it is important to know the causes of stress and the ways to deal with stress. There's what's called general adaptation syndrome. This is an alarm response to stress, a reaction and resistance to stress, and recovery or exhaustion from stress. The physiologic signs or manifestations of stress are increased respirations and heart rate, increased blood pressure, dilated venous vessels near the skin surface, which can cause cool, clammy skin, dilated pupils, tensed muscles, increased blood glucose levels, perspiration, and decreased blood flow to the GI tract. Some situations that are stressful for EMS providers that include the following: dangerous situations, physical and psychological demands, critically ill or injured patients, dead and dying patients, overpowering sights, smells, and sounds, multiple patient situations or injuries, angry or upset patients, family, and or bystanders, unpredictability and demands of EMS, non-critical or non-911 patients, and hospital wait times. Some stress reactions you might experience can be acute stress reactions that occur during a stressful situation, delayed stress reactions that manifest after a stressful event, where you find yourself crying an hour after you left your shift and you're on your way home. Cumulative stress reactions, which is exposure to prolonged or excessive stress. PTSD can absolutely develop and is characterized by re-experiencing the event and over-responding to the stimuli that recall the event. Critical incident stress management was developed to decrease the likelihood of PTSD, and in many states it is law or it is a requirement that a team or EMS, individual EMS or a team go through critical incident stress debriefing after a particularly bad incident. And they may have to go through several sessions of it, but it helps externalize the event so that you aren't carrying it around inside where it will literally eat you up. We'll talk a little more about this later. Post-traumatic stress disorder, I just mentioned, can develop. And again, critical incident stress management or stress debriefing, CISM or CISD, was developed to decrease the likelihood of PTSD. Now, here are some warning signs of stress that you might want to try to be aware of, or you might have others express that they observe in you that could be cumulative signs of stress. And those can include irritability towards coworkers, family, and friends, inability to concentrate, difficulty sleeping, increased sleeping or nightmares, feelings of sadness, anxiety, or guilt, indecisiveness, loss of appetite or other types of GI disturbances, loss of interest in sexual activity, isolation, loss of interest in work, increased use of alcohol or recreational drug use. And you may also develop physical symptoms such as chronic pain, like a chronic headache that just will not go away, or backache, or feelings of hopelessness. Some emotional aspects that you might encounter when dealing with emergency care or providing emergency care. One thing to bear in mind is that even the most experienced healthcare providers have difficulty overcoming personal reactions and proceeding without hesitation. These are normal feelings, and every EMT must deal with these feelings. The struggle to remain calm in the face of horrible circumstances contributes to the emotional stress of the job. Many situations are stressful for everyone involved. Exercise extreme care in your words and actions. Help try to bring a sense of order and stability to the terrifying chaos that the patient is experiencing. And you may be as well. But the calmer you are, the calmer they will be, and the less stressful the situation will be, no matter how traumatic it is. And it will help you think more clearly about what I need to do next. What do I need to do right now? A patient's reaction may be influenced by personality traits. Some people handle things better than other people. Some people are more outwardly expressive. Some people are more introverted. So that's something to bear in mind as well. So allow patients to express fears and concerns. Make sure that you always transport parents with their children as well. So I mentioned that a patient's reaction may be influenced by personality traits, and here are some other factors that influence reaction as well. Socioeconomic background, fear of medical personnel or medicine in general, alcohol or substance abuse, history of chronic disease, mental disorders, reactions to medications, age, nutritional status, feelings of guilt, past experience with illness or injury. So again, give patients the opportunity to express their fears and concerns, and quickly and calmly assess the actions of the patient, family members, and bystanders. And again, it is usually best to transport parents with their children. Now, sometimes there are uncertain situations that you might have to deal with. And sometimes it's unclear whether a true medical emergency actually exists. Contact medical control about the need to transport if you're unsure. If there is doubt, if you are in doubt, then transport. You might have to deal with a violent situation, and these violent situations can be created by civil disturbances, large gatherings of potentially hostile people, domestic disputes, or crime scenes. Now, in reference to that last point, well, all of those last points, but especially like in a crime scene, if there are multiple agencies that respond, it is important to know who is in command and who will be issuing orders. Whose orders do you need to follow? Find that out and make sure you do that. You and your partner must be protected from dangers at the scene so you can adequately provide care. Law enforcement secures the scene before your entry or uses the cover and concealment technique. This involves the tactical use of an impenetrable barrier for your protection and that of your patient. Call for additional help if needed, and do not disturb crime scene evidence unless it is absolutely necessary to care for the patient. But care for the patient and disturb as little else as possible. Now, sometimes you're dealing with behavioral emergencies, and these are emergencies that don't always have a clear physical cause, and this cause may turn out to be physical, like hypoglycemia, head trauma, hypoxia, or toxic ingestion, where you don't physically necessarily see something wrong with their body itself, but clearly they're in some state of medical crisis. And these emergencies can result in aberrant behavior, aberrant or abnormal behavior. Most behavioral emergencies do not pose a threat, but sometimes they do, and you must use caution in those circumstances. Evaluate the patient for behavioral or Evaluate the patient for behavioral or psychiatric emergency and consider these questions. How does this patient respond to you? Are your questions answered appropriately? Are the patient's vocabulary and expressions what you would expect under the circumstances? Is the patient withdrawn or detached? Is the patient hostile or friendly or overly friendly? Does the patient understand why you are there? How is the patient dressed? Is the dress appropriate for the time of year and occasion? Are the clothes clean? Are the clothes dirty? Does the patient appear relaxed, stiff, or guarded? Are the patient's movements coordinated or jerky and awkward? Is there hyperactivity? Are the patient's movements purposeful, for example, in putting his or her clothes on? Are the actions aimless? For example, are they sitting and rocking back and forth in a chair? Has the patient harmed himself or herself? Is there damage to the surroundings? What are the patient's facial expressions? Are they bland or flat, or are they expressive? Does the patient show joy, fear, or anger to appropriate stimuli, and if so, to what degree? If the patient does not respond, the patient's facial expressions, pulse, respirations, tears, sweating, and blushing may be significant indicators of his or her emotional state. Let's talk a little bit about cultural diversity on the job. Every single person is different. So make sure you bear that in mind. Learn from each other. Communicate in a respectful way. And remember that cultural diversity is an asset because it allows us to expand our understanding in communities and in society as a whole so we can help our patients more effectively. Diversity is an effective way to strengthen a public safety workforce. Understand how to communicate effectively with coworkers from various backgrounds. Learn from each other. There's plenty you can learn from each other that you can carry into your everyday job. Now let's discuss sexual harassment and avoiding sexual harassment. Now, as far as sexual harassment itself, there are two types of sexual harassment: quid pro quo, where the harasser requests sexual favors in exchange for something else, such as a promotion. And then there's a sexual harassment situation that promotes a hostile work environment that involves jokes, touching, leering, requests for a date, or talking about body parts inappropriately. The intent of the harasser does not matter. Rather, the perception of the act and the impact the behavior has on someone else are the key questions. Because EMTs and other public safety professionals depend on one another for their safety, it is especially important for you to develop a non-adversarial relationship with coworkers. Report harassment to your supervisor immediately. Keep notes of what happened and what was said, and confront the harasser if you feel comfortable doing so. However, it is worth stating that most employers do have a confidential and anonymous way of reporting that same type of behavior, but do keep notes either way. As far as substance abuse is concerned, it certainly increases the risks of accidents and tension. It can also affect your judgment, so it causes poor treatment decisions. And EMS systems now require their personnel to undergo periodic random tests for illegal drug use. Addicts and alcoholics develop great skills at covering for their behavior. If you find yourself in a situation where you're developing a problem, seek help or find a way to confront an addicted coworker should it be that type of situation. Allowing substance abuse to go on presents a tremendous hazard to the public and also to your team. Employee assistance programs are often available, and EAPs, or employee assistance programs, provide an array of mental health, substance abuse, crisis management, and counseling services, because sometimes the addiction itself is being fed from some other traumatic event in life. So often these services are tied together to target the specific nature of the actual problem. But do not let these things go unreported or untreated. We must mention suicide prevention. A combination of cumulative stress and acute intense stress can weigh heavily on EMS providers. I talked about how important critical incident stress debriefing is. It is that important. But should you find yourself in trouble, if you or a colleague expresses suicidal ideations, you should seek professional help. Absolutely. Many EMS departments have established injury and illness prevention programs. Each program should include 6 interrelated and interdependent elements, those being management leadership, worker participation, hazard identification and assessment, hazard prevention and control, education and training, and program evaluation and improvement. Okay, class, thank you for your time and attention on this chapter. We're going to now go through a series of review questions like we did on Chapter 1 to hit the highlights and most important points of this chapter that we've covered and make sure that you have solid understanding of them. So here we go. Question 1 of our review is the following. A disease that can be spread from person to person is known as A, an infectious disease, B, a communicable disease, C, a transmittable disease, or D, a spreadable disease. The correct answer is B, a communicable disease, and that is a disease that can be spread from one person or another species to another. Let's take a look at the other answers and see why they were not correct. So to remind you of the question, a disease that can be spread from person to person is known as an infectious disease, and that is incorrect because an infectious disease is a medical condition caused by the growth and spread of small harmful organisms within the body, like a flu virus or bacteria. B, which is the correct answer, is a communicable disease, and we just discussed why that is correct. C is incorrect, and that is a transmittable disease, and a transmittable disease is completely different than an infectious disease, as is D, which is a spreadable disease, and that is also incorrect because, again, the correct answer is B, infectious disease. Review question 2. The most effective way of preventing the spread of disease is hand washing, A, B, keeping your immunizations up to date, C, placing a HEPA respirator on the patient, or D, wearing goggles, gloves, a gown, and a mask. I hope you got this one right because I stressed it pretty hard. So let's see if you got the correct answer. Correct answer is, of course, A, hand washing. According to the CDC, that again is the Centers for Disease Control, the most effective way of preventing the spread of disease, is through hand washing, especially in between patients. Up-to-date immunizations and PPE will minimize the risk of contracting a disease. But the best way to prevent the spread of disease, period, out in the general world, not just on the job, is hand washing. Let's look at why the other answers are not correct. So again, the most effective way of preventing the disease of transmission, the correct answer is, of course, A, hand washing. B, keeping your immunizations up to date. That is incorrect because that is part of the overall prevention process. C, placing a HEPA respirator on the patient, is incorrect because this is PPE and it helps to block the entry of an organism into the rescuer. Say, for instance, if a patient is suffering from tuberculosis, it could keep you from contracting tuberculosis. But that's not what the question was asking. The question was asking about the most effective way to prevent the spread of disease, which is hand washing. And D is wearing goggles, gloves, a gown, and mask. Again, that's not correct because that is PPE, and it is selected specifically according to a manner in which a communicable disease is spread. So if somebody's bleeding heavily, say, you would wear a face shield and goggles. So again, the best way to prevent disease transmission and spread overall is hand washing. Review question 3. While caring for a trauma patient, the EMT has blood splashed into her eyes. This is an example of A, an infection, B, an exposure, C, indirect contact, or D, transmission. You should be able to get this one right. The answer is, of course, B, and this is exposure. And exposure occurs when a person comes in either direct or indirect contact with blood or other body fluids. Blood that would splatter into the eyes is an example of direct contact, and that is an exposure of direct contact. It is important to note that exposure does not always lead to infection. Proper use of PPE also helps to minimize the risk of exposure. Let's look at the other answers and see why they are not correct. Again, to remind you of the review question, while caring for a trauma patient, the EMT has blood splashed into her eyes. This is an example of A, infection, B, and that is incorrect because infection is an abnormal invasion by a microorganism. B, exposure, and that again is the correct answer because she was exposed to a blood splash. C, indirect contact, and that is not correct because indirect contact is exposure through contact with a contaminated object. For example, if someone has the flu, for instance, and they sneeze into their hands, they do not wash their hands, they handle a doorknob, and then you handle the doorknob not knowing that it has flu virus present on it, and then you rub your eyes or touch your nose or possibly eat, then you've become infected through indirect contact and exposed through indirect contact. And the last one is transmission, and that is incorrect because transmission is the way an infectious agent is spread through, including direct, indirect, and airborne transmission. So that is not the most correct answer. Number 4, protective measures that prevent healthcare workers from coming into contact with germs are referred to as exposure, A, B, standard precautions, C, transmission, or D, PPE. Now this one should be easy. I'm sure you're going to get the right answer. It is, of course, B. Standard precautions prevent healthcare workers from coming into contact with germs. Standard precautions is that complete set of use of PPE, proper disinfecting of equipment, etc. And let's look at the other answers and see why they're incorrect. Again, the question is, protective measures that prevent healthcare workers from coming into contact with germs are referred to as A, exposure, which is incorrect because exposure is when a person comes into contact with blood or body fluids. B, standard precautions, and of course we know that's the correct answer. Transmission, we know, is incorrect because that is the way in which an infectious agent is spread. And PPE is not the most correct answer because PPE is the equipment used to shield healthcare workers from infectious agents and is a component of the overall preventative healthcare regimen. Question number 5. What is the second stage of response in the stress response known as the general adaptation syndrome? A, recovery, B, exhaustion, C, alarm, or D, reaction and resistance. Let's go back and look and see if you can get the correct answer on this one. The answer is D. The reason D is the correct answer is the body typically reacts to stress in 3 stages. Alarm, which is followed by reaction and resistance, and then recovery. If the individual cannot reduce stress, the last stage will eventually progress to exhaustion. Let's look at the other answers and see why they are incorrect. A, recovery. That's incorrect because it is the 3rd stage. B, exhaustion, and that is if the 3rd stage, recovery, is prolonged, then exhaustion occurs. C, alarm, and that's actually the 1st stage. And D is reaction and resistance, which is the correct answer. That is the 2nd stage. Review question 6. A condition characterized by re-experiencing an event and over-responding to stimuli that recall the event is called A, an acute stress reaction, B, a delayed stress reaction, C, a cumulative stress reaction, or D, post-traumatic stress disorder, or PTSD. This has been in the news the last few years, and we just went over it in the chapter, so I bet you can get the answer to this one. The correct answer is, of course, D, which is PTSD. PTSD may develop after a person has experienced a psychologically distressing event. Let's look at the other answers and see why they are not the correct answer. To review the question, a condition characterized by re-experiencing an event and over-responding to stimuli that recall the event is called A, an acute stress reaction. And that's incorrect because that occurs during a stressful event. B, delayed stress reaction, and that's incorrect because that occurs after a stressful event. C, a cumulative stress reaction, that is incorrect because this occurs when an EMT is exposed to prolonged or excessive stress. And of course, the correct answer is D, post-traumatic stress disorder, and we just reviewed why that was the correct answer. Review question number 7. Blank is the fuel to make the body run. A, sleep, B, exercise, C, food, D, work/life balance. Let's see which is the correct answer. Of course, it's C. To perform efficiently, you must eat nutritious food. The physical exertion and stress of your job require high energy output. So it is important that you eat the correct foods and well-balanced diet. But you must eat. Otherwise, your body will become overtaxed and you will hit exhaustion levels very rapidly, especially if you're exposed to a highly stressful situation. Let's look at the other answers and see why they're not correct. Sleep. That's incorrect because in this particular instance, it's not the fuel that makes the body run. Sleep is important, and it is the consistent cycle of sleep that will improve concentration and motivation, but it's not the fuel to make your body run. Exercise is important, and a regular program of exercise will increase strength and endurance, but of course that's not the correct answer. C, food is the correct answer. D, work-life balance is important and will help you and allow you to relax while you're off the job and help motivate you when you're on the job. Question 8. Which stage of grieving commonly results in blame? Denial, which is A. B, anger or hostility. C, bargaining, or D, depression. The correct answer is B. The person may lash out at the EMT or blame the EMT for the unfortunate event, when of course you're not to blame. But let's take a look at these stages again with the incorrect answers and our correct answer so that we're clear on exactly what happens in this situation. Again, to remind you, 8, which stage of grieving commonly results in blame? A, denial, and that's not correct because denial is not blame. Denial is denial, and that is the refusal to accept the circumstances. B is the correct answer, which is anger or hostility. C is bargaining, and that is a stage during the incident, whether it's a highly traumatic incident or death, where the patient may try to make a deal. And then followed by depression, which commonly results in a silent patient. And those, of course, are not the correct answer in this particular scenario. Question 9. Placards are used on A, buildings, B, individual packages, C, storage lockers, or D, storage papers. The answer is A. Placards are used for buildings and transportation vehicles and refer specifically to hazardous materials. Let's look at the other parts or the other options and see why they are the incorrect answers. Placards, again, are used on buildings, and that is the correct answer. They're also used on vehicles and usually designate the presence of hazardous materials. Individual packages, that's not generally correct. They don't have placards on them. They have labels on packaging. Storage lockers do not have placards. Placards are used for buildings and transportation vehicles, but not storage lockers. And storage papers, that's also incorrect because, again, placards are used for buildings and transport vehicles. Question 10. The 5 most common hazards associated with a structural fire include A. Smoke, oxygen deficiency, high ambient temperature, toxic gases, and building collapse. B. Smoke, oxygen deficiency, inhalation of tar particles, injury from breaking glass, and building collapse. C. Smoke, high ambient temperatures, toxic gases, electric shock, and inhalation of tar particles. Or D. Oxygen deficiency, high ambient temperatures, toxic gases, electric shock, and injury from breaking glass. Now, if you read these carefully, you should get the correct answer pretty easily. So let's take a look and see which is the correct answer. It is A. The 5 hazards most commonly associated with a structural fire are smoke, oxygen deficiency, high ambient temperature, toxic gases, and of course, building collapse. Let's look at the others and see what specifics are contained in the other answers that make them incorrect. We already went over why A is the correct answer. If you look at B, it lists the 5 most common hazards as being smoke, oxygen deficiency, inhalation of tar particles, injury from breaking glass, and building collapse. Well, you aren't always inhaling tar particles. Most often there are toxic gases. It may or may not be tar particles, however. So that's one tip off that would be an incorrect answer. And just because there's a fire doesn't mean that there's a propensity for breaking glass. It could be an empty building that's on fire that has all the windows broken out of it. Or a new construction where no windows have been installed yet. So if you just read carefully, usually you can figure out the correct answer. So let's look at C and D and see what elements of those are tip-offs that those are incorrect answers. So if we look at the 5 hazards that they have for letter C, they have the 5 most common fire hazards as being smoke, high ambient temperatures, toxic gases, electric shock, and inhalation of tar particles. Well, we've already talked about this, and it says also right here, smoke is made up of particles of tar and carbon. And so you don't generally just have tar particles. Smoke is made up of a combination of carbon, tar, and usually toxic gases. And then you also have no guarantee that there is going to be electric shock present at a fire. There may not be a power source involved in a specific fire. And then D, you have the 5 options as oxygen deficiency, high ambient temperatures, toxic gases, electric shock, and injury from breaking glass. Well, we talked about how there may or may not be the possibility of injury from breaking glass, but in this particular answer, smoke is missing from this option, and that is the big one. So again, if you read these questions carefully, where you have multiple possibilities, just make sure you read them carefully and think logically, and you'll usually get the right answer. Thank you for your time and attention in this class, in this chapter, and I will look forward to working with you in Chapter 3.